So our next speaker is Dr. Dave Vella. Dr. Vella has more than 32 years. He practiced in a major health system before he resigned at the height of the COVID pandemic because of the policy violations and the abuses of medical ethics that he saw, and he couldn't stand with that anymore as a Christian. After leaving traditional medicine, he became a strong advocate of helping patients stuck in the traditional medicine hamster wheel. Dr. Vella is currently active in organizations fighting for medical freedom, and he's here tonight to update us on the ongoing legal issues that still surround the COVID vaccine to this day. So, Dave, take it away.
Thank you, Tim. Okay, so this is called COVID, Can You Handle the Truth? So we're going to start with a very important subject here. I think most people here understand that something very strange happened several years ago. There was a sudden, dramatic change in people's cognition and behavior. Any non-mental health professional here tell me what this image is? The Rorschach test. So the Rorschach test is a tool that psychologists have used to gain insight into the emotional state of an individual and how they are interacting with the world around them. Now, I would suggest to you that we don't need to show anyone 10 bizarre and scary slides to figure out what is going on in their head when it comes to COVID. All you need to do is show them this one simple chart. And this is, of course, the Vaccine Adverse Event Reporting System data for the last 30 years. Anyone can access this on openvaers.com. You can do the searches and reproduce this yourself at metalerts.com. So what we're seeing, so these are total deaths reported to VAERS after any vaccine given on the market that particular year. So you can see for about 31 years, the data is pretty stable. We're running at a couple hundred deaths per year, and there's several dozen vaccines on the market every year. And then we get to 2021, and something very strange happens. And we see the deaths being reported to VAERS after we roll out an experimental treatment, which is experimental genetic treatment, which is mislabeled as a vaccine, and we start seeing the reports to VAERS skyrocket. And by the end of the year, we're well over 20,000. And this could be seen right at January, because this data is released to the public every 2 weeks. And the campaign started December 19th. By the first couple of weeks of January, when they were releasing the data, they could see this going up. So, now, when I was going to medical school in the 1980s, we were kind of working under the assumption that any new medical product that we would bring to the market would be at least as safe and effective as anything previously. Okay, so when I look at this data here, which is pretty stable over 3 decades, and then I see this, I don't see safe and effective. Okay, I see quite the opposite. I see dangerous and reckless. That's what I see, dangerous and reckless. So the obvious question is, how is it that I can see this, and you all can see this, but every public health official and doctor who recommended this is incapable of seeing this? Well, yeah, so we fully understand the psychopathology here, but it is quite complex. In trying to explain that, I really don't have time to explain that to you right now. What I'd rather explain is we never even need to see this signal in the first place. These people never should have died, okay? Because we can actually back this bus up by several weeks. when in December of 2020, the single 2-month data was released from this phase 3 clinical trial and used as the trigger to launch this needle in every arm campaign. And what I can tell you is every U.S. trained medical doctor who recommended this dangerous substance failed 2 critical standards of care for safe medical practice and licensure. 2. So these 2 standards of care are so fundamental that they are tested on in the first part of the United States medical licensing exam in year 2 of medical school, because the fund of knowledge is expected to be acquired by that time. So the first of those 2 standards of care involves basic interpretation of the medical literature. Specifically, the ability to assess the safety and efficacy of any new product that is brought to market and communicate those risks and benefits to the patients in the way that they can understand. So the question is, why would this be so important? Okay, so throughout human history, it's been demonstrated, an unfortunate behavior that recurs. It's almost predictable. Typically, in a time of distress, a proverbial snake oil salesman appears on the scene with a fake cure, seeking to profiteer off an unsuspecting and often fearful community. Does the situation that I described sound familiar to you? Does anyone think that this might be what happened in COVID? Okay, so this is the specific reason for this critical skill. The second standard of care that was violated is it has to do with adherence to medical ethics and specifically respect for patient autonomy and affording the patient the ability to exercise either informed consent to or refusal of any treatment that they are offered. This is the second. So patient autonomy is one of our 4 foundational principles of medical ethics, what most medical ethicists agree is the most important of those 4, and it is inextricably tied to informed consent. So what I can tell you is in this particular scenario, the ability for the physician to exercise these 2 standards of care was astonishingly simple. Astonishingly simple. And the reason is, this is the first time in my medical career that a product was brought to the market with just 1 single data set. Okay? There weren't 5 studies, weren't 4 studies. There was 1, and that was what was used to launch the campaign. And what I can tell you is first of all, and it was presented in the most recognizable medical journal in the country, the New England Journal of Medicine. So, and what I can tell you is immediately upon looking at that abstract on the first page of that article, that medical student would immediately recognize that the 95% effective in the results section that they quoted, they should have immediately recognized that as medical, basically medical fraud. That's a known deceptive statistical tactic, this 95%. It's called relative risk, and that's a known deceptive statistical tactic. So that's like immediate. And within 10 minutes, that medical student should have been able to produce this very simple risk-benefit analysis, looking at the very few numbers that were presented in that results section on that first page. So this is the standard of care for communicating risks and benefits to patients, especially if it's something experimental, new. It's called numbers needed to harm. That's the risk, and numbers needed to treat. That's the benefit. These calculations are so simple that most STEM-oriented people could round the numbers in their head, run the calculations in their head, and come up with these approximate numbers within 5 minutes, like I'm saying. So, such that when the patient came in and said, "Hey, doc, I'm worried," Mr. Fauci says, we all got to take this shot to protect ourselves. What do you think? Well, the correct answer, Dr. Smith, should have said, well, Mr. Jones, based on the 2 months of data that's just been released as the science for this, we actually have to treat 119 people before we prevent one single case of COVID, no matter how mild. So that means you have a 1 in 119 chance of receiving any benefit from this treatment. And what's worse, Mr. Jones, when we look at serious cases of COVID versus serious harms, a serious case of COVID is if you get a case of COVID that's so severe that you actually wind up in the hospital from it. So for a serious case of COVID, to prevent that one hospitalization, we have to treat more than 2,600 people, okay? But what we found is by the time that they treated for every 1,400 people they treated, they already caused a series of harm. A series of harm is defined as a death, permanent disability, or hospitalization. That could be a heart attack, stroke, arrhythmia, pulmonary embolus, other blood clots, you name it, they saw it all. So based on this information, Mr. Jones, you are twice as likely to wind up in the hospital if you receive this experimental injection than if you just, we face the COVID on our own and do the best that we can. I can't possibly tell you you should take this treatment. So this is the standard of care. It's provable. It's backed by every medical education institution across the nation. It's in the educational materials. It's for the board certification. So every professional medical society and across the medical regulatory agencies, the FDA wrote a book on this, specifically saying, this was in 2011, it's called Communicating Risks and Benefits to Patients, specifically saying, do not use relative risk. You know what 95% is? I think I said it. That's relative risk. They said, use numbers needed to harm and numbers needed to treat, a risk-benefit analysis. That was never done with any of the countermeasures that were used, whether it's the shot or whatever. They were always promoted on the basis of theoretical benefits without any concern for any risks. And this was done across the board. And this, this has a lot of implications. So let's see what are the implications of this risk-benefit analysis, which was never done, whether it was for masking or lockdown. They never calculated the risk. This is the little golden key that unlocks the door to a universe of both civil litigation and criminal prosecution. Right. We just got to get people to wrap their heads around that. Because they all think they're protected. They all think they're protected by the PrEP Act, but we have rulings now. They are getting either circumventing or piercing the PrEP Act, and these people think they're all immune to this liability. But I think we're going to break through. So what are the implications of this risk-benefit analysis? First of all, as I told you, failure to provide the community standard of care by any U.S.-trained physician who ordered or advised the experimental injection for a patient. Dereliction of duty of any public official who advocated for the genetic treatment. So basically, these public health officials, the vast majority of them are MDs that have gone on and gotten an MPH, Master of Public Health. But some of them could be just MPHs, but they're aware of how to do these calculations. By the way, these calculations, this is not like high-level statistics, okay? But those, to arrive at that number needed to harm and number needed to treat, this is extremely simple math, okay? This is simple percentages introduced by the 5th grade, and the most basic algebraic equations introduced by the 8th grade, okay? This is extremely simple. My kids were in accelerated math. They had these concepts down by the 6th grade, but I can tell you a 10-year-old has the mental development to understand these if you work with them. So it is a duty of the public health officials to calculate the risks as well as the benefits when they promote something. And as we said before, no risks were ever calculated. Who's heard of the Great Barrington Declaration? So that was those public health experts, Jay Bhattacharya, Martin Kulldorff, and Sunetra Gupta out of Oxford, who said, wait, something's wrong here with all this lockdown stuff. We're actually killing people worldwide with these lockdowns, you know. So they never calculated the harms of any of the things they've done. And then misrepresentation, violating numerous state and federal advertising and sales laws by companies promoting the vax, okay? So this is what I'm telling you, the 95% is known statistical misrepresentation that fits these legal definitions. They knew the risks. Everyone knows about all the fraud cases against Pfizer. They actually knew about all the harms, and that's why the FDA tried to hide the data for 75 years, right? Everyone knows that, and that's what alarmed a lot of people. Say, okay, we have fraud. They're hiding from the public, you know, something. So that's fraud. So that allows us to get to open up a whole lawsuits on that point. And finally, failure to meet the legal criteria for issuing. This is verbatim, okay? I italicize that because this is actual verbiage out of the PrEP Act. Failure to meet the legal criteria for issuance of authorization of a medical countermeasure, if you're familiar with that term, that's what these are all called, by the HHS Secretary Becerra, in accordance with the PrEP Act and the FD&C Act. It specifically states in these acts that anything he names as a countermeasure, the benefits must be known to outweigh the risks. I just proved to you that on a singular evidence that they presented to the world and pulled the trigger on, we can prove that the risks outweigh the benefits. So this is some good news. So unfortunately, it's in Ontario. So this young man was, I think, 17 years old at the time. He was either a junior or a sophomore, or a junior or a senior in high school in Ontario, not far between here and Toronto. He received the vax. He had to take the vax to play hockey, and within a week or two, he was dead. And actually, the American pathologist by the name of Ryan Cole, his father sent his tissues to Ryan Cole, who found the spike protein throughout his body, and he was able to determine, you can determine whether the spike protein is from the vax or if it's from natural infection. Okay, they are able to determine it. And he was able to determine and say, no, it was from the vax, okay? And so his father would not let this go. So for 2 years, this father is searching for an attorney to take his case. He finally found an attorney in British Columbia, all the way across Canada. And they just filed suit against Pfizer for $35.6 million. This was just announced just last month, okay, about 4 weeks ago. So I don't know if Canada has the same protections with this PrEP Act that they think they're protected from in the United States. I don't know if they have those same protections. But look what the attorney is arguing. So this is from the attorney in the article, what he's quoted as saying. Pfizer owed a duty of care to Sean Hartman to accurately inform him of his risks associated with the Pfizer-BioNTech COVID-19 vaccine. Okay, no proper informed consent. Standard of care. This is verbatim. Okay, what Mr. Sheik is saying. Alleged was breached when it disregarded, misrepresented. This is the language. The results of the safety trials by providing an incorrect characterization of the efficacy data. And finally, improper product distribution when it was being sold. This is because the foreseeable risks exceeded the benefits. This is exactly what I told you. I actually produced an affidavit, what I condensed right here. I have a 3-page affidavit that I've been trying to get out to attorneys. That basically shows the mountain of evidence in the public domain, across the public domain, that proves this standard of care. Okay, like I said, not only in the medical education world, but in the medical professional society world, and in the federal and state regulatory agency world. It's a massive data proving this. So, okay, so this is, so I'll finish that up, and this is, something new or something breaking. Okay, this has to do with the vaccine contamination, okay, or I shouldn't be saying vaccine. The vaccine contamination, okay, how many people have heard that that the shot that all these people got, if they got it, okay, don't worry if you got it, okay, because the first thing I tell people is if I find out that they've had the shot, I say, God bless you for thinking you were doing something right, okay? But you must realize that the vast majority of people actually did not get what they thought they were getting, okay? Can anyone tell me what happens to a product when you warp speed it? What happens to the final product?
Poor quality.
Poor quality, okay? So the vast majority of people who took this shot actually did not get the full length of genetic code, modified RNA, to produce the spike protein. So they got shortened segments. We don't know what those shortened proteins are capable of. It's just a massive unknown. Okay, it's a massive unknown. So I kind of ease them. So if you're ever in conversations, hey, God bless you for getting that, but you it's nothing happened to you. You never felt anything. You probably didn't get it. Okay. If everyone did get what was intended, this situation would be 1,000 times worse than it is. So, what it turns out, and this is part of it, there was a process that was used to create this modified RNA in the clinical trial, 44,000 people. And it was a fairly pure process, and it had maybe a 90% integrity level, capable of producing the full RNA, or capable of producing the spike protein. Well, that process was very difficult, okay? And if they wanted 5 billion doses across the world, they weren't going to get it out. They had to switch to what's called process 2, okay? So so all these billions of people who got this shot, they didn't get what the people in the trial got. This is like crazy, because this is known in biological, therapeutic research. If you're making not a standard drug, like a chemical, like is what you think of as a standard drug, when you're making a biological agent, okay, which this genetic material is, if you change the way you make that agent, you totally change the effect of it. You got something different, okay?
David,
Yeah.
can we do 10 minutes of Q&A right now?
Sure.